Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today I'm going to talk about the very surgical procedure that is at the center of exactly that, helping people look as young as they feel. And that is the technique that I developed and I patented and I trademarked called the vertical restore. So let's talk a little bit about how it differs from the traditional facelift and why I decided to develop this and switch my entire techniques to this particular approach. So let's break it down a little bit in terms of how the face ages and where a facelift fits in and how a vertical restore addresses some of these changes. And then we can really look at the differences at that point going forward. So let's break it down. So the face ages when we're thinking about the fundamental changes that are affecting the transition from somebody looking young to old. It's facial shape, right? We all see that. I mean, you can see that literally from a mile away. It doesn't require to get close, and it's not a high intensity diagnostic sort of thing. It's like you can identify somebody who looks young and old just based on facial shape, and you can literally identify somebody in that category from across the street. So what happens is, as we age, usually around the mid to late 40s, there is a transition, and some think it might be related to the perimenopausal changes, but there is a drift of the fascia that starts to get elongated and the face starts to get heavier and goes from the top down towards the bottom. When you see that, the jawline starts to become more square as opposed to that oval or heart-shaped overall look, and the neck starts to sag. But when you really break it down, you see there's several other things that are happening simultaneously along that area. Typically, as that occurs, the corners of the brow are coming down, the mid-face is starting to sag, then leading to the jawline, and then leading to the neck. So where does a facelift fit into all this? A traditional facelift, or what's termed as the SMAS Facelift, is a technique that's been around for a very long time, and it's performed by probably 90 to 95% of plastic surgeons and facial plastic surgeons. And basically what it is a procedure that is designed to move the jawline back towards the ear. It's a horizontally based redirect of the jowls. And when you do that, even if you've got some hanging jowls here, when you do that, you're gonna see things are gonna go, get a little bit smoother. But what you're doing is you're flattening the jowls and you're pulling them. And that's not exactly the way the face aged, right? I mean, if you're going horizontal and the face originally came from top down, then you're sort of going in the opposite direction, or perpendicular almost to where the natural aging direction was. So as a result, the end outcome is somebody who looks slightly different. And all of us know what that different looks like. The minute you see it, same way you can tell somebody's older, within the same split second you can tell somebody's had work done because they don't look quite human. And that's one of the biggest raps the facelifts have gotten over the literally decades, is that you can tell within a split second that somebody's had work done. And that's not a good thing, because I don't think anyone really wants to look like they've had work done. They want to look like themselves, they want to look like they did when they were younger, but they certainly don't want to look like they've had work done. But what can you do when the technique is flawed? It's not the right concept, it's built on the wrong paradigms. When you open up most of our plastic surgery textbooks, you're going to see facelifts showing a effacement going horizontally. Now, as I mentioned, there's other components going on at the same time: the outer brow, the midface, jawline, and neck. So then sometimes surgeons will add in a neck lift, platysmoplasty to kind of tighten up the neck muscles this way, and then pulling everything backwards, but still more or less kind of redirecting everything horizontally. Now, that leaves the midface and the lateral brow alone. Way before I even started doing facelifts, I found that the operation led to an unusual looking outcome. And even when I was a resident, I actually told myself, I'm never gonna do facelifts because it just looks bad. It doesn't look good. So I was gonna truly focus my practice on cancer reconstruction and rhinoplasty. But then I started to learn more and started to hear whisperings of this concept of a vertically oriented lift. And as I saw those outcomes, they truly did look much more natural. And this was somewhere around the mid-90s when this concept started to become a little bit more aware. So basically, as I had the opportunity to learn more and educate myself further independent of what I was being taught and told, I realized that the basic aging concept is there's fascia underneath the skin, and that fascia starts up in the temporal region and goes all the way down to the clavicle, and that all of it is basically one unit. And that is very different than looking at jawline as a jawline and a neck as a neck. I just thought of this as all one. So basically, even before I developed the vertical restore, I was doing vertically oriented facelifts, I was doing lateral brow lifts, which brought up the corner, and then I was doing neck lifts. So there was like 3 procedures I was doing. What I wasn't getting at was the mid-face. So about 10 years worth of surgical work, 10 years worth of results that I was able to see, I thought to myself, how can I make this better? And there was 2 areas that I thought I could make it better. Actually 3. One is I wanted to get the mid-face up. 2, I wanted to make sure I got a very aggressive neck lift down because everyone wants a great neck. And then 3, I wanted this to be the longest lasting procedure on the planet. I really wanted our patients to get it one and done and not have to think about it for a very long time. So I went to the drawing board, and basically what I realized is that in order to get durability and to be able to get a significant change in the mid-face, we needed to go to a deep plane. The deep plane approach is something that was developed around the mid-80s by a plastic surgeon named Sam Hamra in Dallas, Texas. And the concept was intriguing to me because you're releasing the ligaments in the jawline and the mid-face, and you're bringing things, in a full release. The problem is with a standard or more conventional deep plane, it is still more or less a horizontally based procedure. And I have been used to, for the last 10 years, going more or less vertical. But what I realized is if I get more release all the way down through the neck, I can actually tilt this entire soft tissue platform more vertically and bring it all up, and at the same time address the lateral brow in every single case. So that is where the vertical restore was basically born. It was a concept that brought 4 different procedures into one, which was the lift of the lateral brow, the mid-face, jawline, and neck, and it addressed everything at the level of the deep plane, which we knew was the most advanced type of a facelift procedure. In fact, it's probably done less than 5% of surgeons in the country, probably in the world, who are doing deep plane approaches. And when you combine all of that, you're getting full comprehensive repositioning of the entire soft tissue platform. It looks natural and harmonious. You're also getting a significant elevation of the mid-face, which is really important for getting a softening of the nasolabial fold. And by bringing the neck in and doing a very aggressive neck lift in every single case, you're getting the most out of the neck as possible. So with that, I do either a central neck lift or a subplatysmal dissection, bring everything into play and get full freedom to move everything up. The procedure is very advanced, but the outcomes remain totally natural looking, and they are extremely durable. So somewhere around 2017, I switched my entire technique to this, and it's been an amazing run of beautiful, beautiful outcomes and extremely happy patients. So when you look at the fundamental differences between facelift and the vertical restore, it comes down to vector, more vertically oriented, the comprehensive addressing of all the different elements that are involved in aging, and ultimately the use of the deep plane. Another important difference between the vertical restore and the traditional facelift is that the traditional facelift performed by most plastic surgeons is performed under general anesthesia. The vertical restore in my practice is performed under local anesthesia with IV sedation, which in my opinion makes the operation incredibly more safe and also takes away a lot of the post-anesthesia 2 or 3 days of grogginess and recovery. So it speeds up recovery and really enhances the safety of the overall procedure, and our patients are incredibly comfortable during the entire process. So that is a huge advantage of the vertical restore. And you bring it all together and you have a very advanced, very beautiful, reliable particular procedure that I perform for our patients. And I hope that helped. I hope that brought it a little bit more clarity into the differences between these procedures. And honestly, at the end of the day, a picture is worth 1,000 words. It doesn't take all this explanation to understand that there's something different about these outcomes. There's something a little bit more high impact in terms of the level of correction. And ultimately what's so beautiful is the consistency that no one looks like they've had work done. No one looks like a different person. They all look like themselves, just 10, 15, 20, 30 years younger, depending on how advanced their age was to begin with. And quite honestly, it's hard for me to imagine how it could possibly be better than what we currently have going on with the vertical restore. All right, guys, I hope that helped, and I hope that answered some very fundamental questions, and a question that does come up all the time, difference between vertical restore and a facelift. If you enjoyed this content, guys, please hit like. If you want to share this with friends and family who are considering and looking at these procedures, please share it. Make sure that you subscribe to the channel. I am putting out content like this, educational material, 2 to 3 times a week. And if you have any questions or comments, drop them down below. I will be sure to do my absolute best to connect with you and answer those the best I can. All right, everyone. Thanks so much. Dr. Amir Karam.